What's up, everybody? Welcome to the Mike Dolce Show. We have a very important guest today and someone who I do call a friend, though we haven't spoke in quite some time. We have Dr. David Hawkes, virologist, on the show today, and he has so generously given us his time to help us understand what the coronavirus is, what is COVID-19, what peril the world may or may not actually be in, and what we as regular hardworking citizens of this beautiful planet, what we can do in our homes and in our communities to help the medical and scientific community tackle this with all of their brilliance and all of their force and continue providing a better health and world for us. David, how are you, sir?
I'm good, thanks. Thanks for the introduction. So yes, I am a virologist. I did a PhD on HIV. I've worked for, it's getting scary now, but I've been a virologist for about 16 years, and I've been in medical research for nearly 20. And my current position is, my specialty is lab diagnostics. So all the testing that is now, everyone's really interested in is what I've been doing for 5 years. And so suddenly I've got a skill that everyone's interested in getting my feedback on. So this is that one time where I'm actually, if we were having dinner parties, I would be the popular guest.
Absolutely. I'm sure you're always the popular guest. I'm sure you got some great stories. And we still, I mean, the first time you were on the show, we really spent most of our time talking about vaccines, because the vaccine conversation, even today, it's just as relevant today as it was, 6 months or 6 or so years ago. Very relevant. We got great feedback, very polarizing. People who had their own bias, it either reinforced their confirmation bias, or it completely or they just wanted to go out and get crazy, either get mad at you or completely agree with love you. I'm sure you're used to that at your dinner parties too, right?
Absolutely. I mean, the thing is that science, I guess I've come to the conclusion over the last few years that what particularly, and I'm talking about biology here, sort of no one has this discussion about astronomy. No one sort of really kind of goes, oh no, there isn't a planet Uranus because I can't see it with the naked eye. It's all a scam by NASA. Yep. But biology is something that everyone is actually involved in. Everyone has a body. Everyone has all those things. Everybody has their own experience. And the problem is there's no laws of biology. There's laws of physics, there's laws of chemistry, but there's no laws of biology. I take the example as you can give somebody a kidney and say, work it out. And you can't just figure it out. But as a human race, it took us 400 years. But everybody kind of knows that, oh, if I do this, my kidney gets sore, therefore this makes my kidney sore. And that's sort of taking that experience that we've learned over the tens of thousands of years of being humans, and that's how we acquire knowledge. If somebody in our tribe, our family, our group does something that is associated with a bad event, then we all sort of learn not to do it. And that could be from eating the poison berries to trying to hand fight a saber-toothed tiger. And that's why we have those experiences, and that's how we learn. And it's not because people are stupid. It's not because people are rejecting information. It's because we are hardwired to learn things that way. And this stuff is not easy. As I said, I've been doing this for quite a few years, and I know a pinprick of a pinprick of a pinprick of an area that is my little area. And if you ask me about how the immune system reacts, I kind of glaze over and I'll direct you to someone else, because that's how it works. And that's why I think that, having conversations is the best thing, because we learn through conversations. We've sort of, one of the things we've adopted in Australia is what we call 1,000 cups of tea. If you're going to actually impart knowledge and get people to sort of, gradually change their minds on something, it will be done over 1,000 cups of tea. It won't be done by someone coming in and just lecturing them and telling them they're wrong.
Sure. I love that. That's a great metaphor right there. And it's so true. My little pinprick of a pinprick is in the health and fitness realm. We're really trying to help change lives, get people healthy, living in a manner that hopefully offsets medical intervention, right? Lifestyle management is really such a big part. And, we understand that, but it takes time. It takes education. I mean, it takes, not just one conversation, but hundreds, thousands of conversations, daily interaction, engagement, and their own personal experience of eating better day in, day out, exercising better, thinking better, sleeping better, before they finally start to realize, well, hey, wow, this might actually work. So I totally, understand that. It's a great, analogy. And with that, so those listening right now, myself included, we are inundated in the 2020 social media, mass media world. Every person is an expert now. If you have a Twitter account, you are an expert. And every television channel that we watch, we assume these bobbleheads are experts, and even the credentialed experts, whether they be politicians or private sector, public sector, medical, scientific, are experts. But there's so many different views and approaches and also agendas. So I'm hoping you can really step in and help us with a scientific mind, clear away a lot of the bias, a lot of the nonsense, and just factually help us, number one, understand what exactly is the coronavirus.
Sure. So, I mean, I guess the thing is that something that a lot of mainstream media doesn't like, and a lot of experts don't like, is saying, I don't know.
Yes.
I'm going to say I don't know a lot. Again, it's like, I'm a virologist. I'll give you the information that I've got for you. But again, I think we're up to 85 days since we've identified the virus. So you think 85 days, that's, there are losing streaks in professional sports much, much longer than that. And so, that's what we're looking at. So anything that I tell you was based on the best information I have today, which is Sunday, I think the 22nd.
Yes.
But the thing is, I also have to be aware that it will change, and I have to be flexible. And this is, there is some information that we do know that we're pretty sure of, and there's some information that we don't know, and we're trying to evolve that. And I'll try and make it really clear what we do know and what we suspect, so that, people, get an idea of, if they hear something and go, oh no, that's completely wrong. It's like, we're making our best guess at the moment, and things are changing. I mean, the classic thing is how dangerous this virus is in terms of how many people it kills. And there's so many factors that go into it. It's like, if you have a population that's all over 80, it's going to be more lethal. If you have a population where everybody smokes 20, 30, 40 cigarettes a day, it's likely to be more lethal. If you have a population where they don't have access to healthcare, it's going to be more lethal. If you have a healthy living with nobody has any sort of pre-existing conditions, nobody has autoimmune conditions, nobody has heart disease, nobody has anything, it's probably going to be less lethal. And I live in Melbourne. We're a city of probably about 4 million people, and you can go from suburb to suburb, and that equation will change.
Sure.
And so that's sort of just the example. But basically, coronavirus is a type of virus. If you excuse me, the background is I'm currently in my bedroom dodging my two young children. So if you do hear any noise in the background, I do apologize.
No, we appreciate it.
So coronavirus is a class of virus. So the equivalent is, we talk about lentiviruses, and one of the most famous lentiviruses is HIV. So coronavirus is just a group of viruses. It's just the term we use. And I'll generally use coronavirus because that's the term everybody uses. But this particular coronavirus is called SARS-CoV-2. So severe acute respiratory syndrome coronavirus 2. So that is the official name. We used to call viruses based on where they were found. So we obviously had Ebola virus from the Ebola River. We had West Nile virus from the West Nile. But in 2015, we changed the way that we actually name viruses. And so we try and actually name them not based on people or places or those sorts of things, because, there is some racial overtones in there, and there's some other things. So, the example, we've been doing it. So human immunodeficiency virus, human papillomavirus, guess what those two things cause? And sudden, a severe acute respiratory syndrome, coronavirus 2. There is sort of what we're talking about. So there is no Wuhan virus. There is no Chinese virus. There is an official name, and that's what it is. So the general theory is that this was in bats and it transferred over to humans. Now, there's a lot of really genetic information that shows that, yeah, we're talking about really small changes have allowed this to happen. So less than 1% of the DNA or the RNA of this virus has allowed it to change over. And we've seen this before. We saw it with SARS. We saw it with a virus called Hendra in Australia, which we get these really small outbreaks. I think it's killed 10 people in about 15 years. And it's named after a suburb of Brisbane in North Australia called Hendra. And it goes from the bat's poo around horses. Horses get it. Horses pass it to people, but the horses also die. So this is something that happens. There's Nipah, which happens in Malaysia. Bats are warm-blooded mammals that are really close to humans. So it kind of makes sense that, you know, we can get these sort of crossing overs. And that's where we think it came from. And this is one of the factors that, well, we know we have viruses in Australia that are carried in our native animals, and they don't infect humans, but we have one called Kunjun, which is 98.5% identical to West Nile virus, which Americans are particularly familiar with. Sure. So we know that it's only going to take a couple of changes for that native virus that's been in Australia for however many hundreds of thousands of years to potentially get into humans. Every place in the world has things like this. This is just, you know, they pop up, they might pop up occasionally. SARS popped up in 2003. We've never seen it since. So we don't know how long this thing will last, but what it seems to be is it seems to be really infectious. Really, really infectious. But again, the other thing I'd point out is that we've seen viruses like this before that are this infectious and are this lethal. One of them is called polio. One of them is called smallpox. These things are much more infectious and much more lethal. The difference is, as you said, is we have social media now. In the 1950s, this was before we had television in Australia. We would have had radio, but, you know, even our cities are about 1,000 kilometres, 500 miles apart. What was happening in different cities probably wouldn't be that well known unless it was, you know, really, really big news. We wouldn't have known about a little virus outbreak there unless it was something happening across the whole country. Now, I've heard a story of somebody who is in quarantine in the UK with their Tinder date, their first time Tinder date. And you just hear all these sorts of things, which are on such a small scale, such a personal effort. Sure. That you sort of, you know, you're much more aware of it. So we are aware of it, but this virus is not something that has never been seen before in terms of how it behaves and how it reacts. So the difference is we can do things. So I've gone on for a bit. Am I staying on track roughly?
Yeah, you definitely are giving really good context and really kind of, I think, lowering that DEFCON 5 huge red alert. You know, we've never seen this before. This may wipe out the population. Many of the talking heads say, like, listen, 45 to 70% of the global population will get infected. Now, they do this for marketing. They do this so you tune in. They do this because statistically, that might be a model that may be correct. It may point that way. But then they talk about how people are dying and they point to the death rate. So a lot of the media out there really, they conflate the facts to create this narrative. And I believe it's a false narrative. You know, again, in individuals, you know, like yourself, I have some friends that work in the medical field. One of our friends had said, listen, like, we've seen way worse viruses and illnesses and conditions before. We're not worried about our ability to treat this from a global perspective. Some people will die and some people will not be able to tolerate. Absolutely, that will happen. But big picture, we've seen way worse before. They said what we're most concerned with is the sociological impact of what it will do to the population, how people are acting right now. So kind of the collateral damage of these news reports really seems to create this doomsday scenario, if you will. And I'm trying to help our audience get a better understanding of the true science, as you know, from your mouth, of what it is. Well, we've seen before. We've seen worse before. Not that they were looking for a polio type of event and the rush to build a vaccine. That's a Dustin Hoffman movie. Essentially, what we're trying to get an understanding is some people will get this. I may or may not have already had it. Those listening may or may not have already had it. I had sniffles a few weeks or so ago. I have a dry cough from time to time. Well, this change of seasons here also. It could be a birch allergy. It could be that simple, right? So but that really is getting a lot of people to think, oh no, I have it. Like, do I have corona? Do I have seasonal allergies? Do I have the flu? Maybe I just talk too much and my voice is a little raspy and sore. But the media now has us believing we should be in queues at these outdoor corona testing centers, you know, worried about how many hospital beds and ventilators there are. So, again, that's kind of the doom and gloom. So again, let's bring it back. Coronavirus, it appears to be a mutation. We've seen similar things before. Highly contagious, of course, that seems to be true. But as we're happening, so right now, 85 days in, what is the medical consensus? What do you guys think, and where are we looking at from here?
So I think that, what we're looking at is, if you get 40 or 70% of the population get it, that's feasible. I mean, you could say the same thing of the common cold or influenza.
Sure.
What all the approaches we're taking for, and what they're intended to do is to, if you imagine the population of your area is 100 people.
Okay.
If 10 people get it and then get over it, and then 10 people get it, and then you only ever have 10 people have the virus at the one time, you can deal with it really well.
Sure.
If you get 50% of people get it at the one time, your rubbish isn't going to be collected. Your mail isn't going to get through. It's really disruptive, both economically. It's going to affect people's health. If both parents get it, obviously it's harder for them to look after kids, particularly if you get severe disease. And again, it's hospital beds and ventilators and all those sorts of things. So we have some rough figures that 80% of people will get it mildly, and in that mildly includes people that get it asymptomatically. And I guess, to go back to your cough and cold, in Victoria, again, we have a state of about 5 million people. Every week, 250,000 people get respiratory illnesses.
Okay, wow.
To give it some context, so everybody gets the sniffles. I've actually been in quarantine for coronavirus. I did not have coronavirus. What happened was, I'd been in Singapore. I came back. I got a virus off a cough and a cold from my 3-year-old who got it from childcare. And there was a bit of a political storm about healthcare workers, which includes me, potentially spreading it. So I stayed home from work. I got a coronavirus test and a normal respiratory test. I was at home because I'd taken a couple of days off to do other things on a Thursday, Friday. I was away on the weekend. We had a day off on the Monday. I took another 3 days off to get my test result, and I was negative for it. And I had a rhinovirus, which is the common cold. So I've kind of gone through it myself. So I've had the swab stuck up my nose. So if anyone's wondering, that's all the test is. They stick a swab up your nose. It's not comfortable, but it's not, particularly horrendous either.
They did that to my kids last flu season to see if they had the flu.
Yep, that's exactly it.
Okay. My 4-year-old dealt with it, no problem.
Yeah, I've broken my nose quite a few times, so I'm fairly desensitized, so it didn't bother me too much. But yeah, sure. that is what the test. So I guess that's one of the other things to say. What they're trying to do is, everyone's a bit panicky. The general medical view is, if you don't have a fever, don't stress.
Gotcha.
As a general rule, yes, because realistically, if you get the coughs and colds, if you're going to get severe disease, you pretty much always have the fever. Yep. So if you don't have the fever, even if you do get coronavirus, it's going to be pretty mild. We're telling everyone in Australia that if they have those coughs and sniffles and stuff, to just, if you're sick, stay home from work. Australia has a bit of a different system. So at our workplace, we get 21 days sick leave a year.
Okay.
So if you're sick, you go to a doctor, the doctor says, yep, you're sick. And so we pay you for those 21 days. Obviously, it's a different system in America, but that's the situation we have in Australia. So we have a situation that is actually not prohibitive to actually take sick leave if you're sick. So it does assist us in this manner. And so I've had staff, with coughs and colds who have just been staying home, might have stayed home an extra day just in case. And then they come back to work and it's all fine.
And I'm just curious, is that a nationally funded program that supplants the business with, fees or tax dollars to pay the wage of those sick individuals? Or is that completely funded by the private corporation?
So essentially, we're a not-for-profit, and so ours is a bit more generous, but I think it's legally mandated in Australia that you have to have at least 5 sick days.
Okay.
And that essentially that gets factored into the wage that you get paid. So you get paid, we have 4 weeks annual leave. And once you've been working for 10 years, you also get long service leave. So you get a number of weeks every year that you can take. And so we have quite generous leave. And so
Sure.
that's all sort of factored in. We also have, I think the equivalent is what you guys call a 401k, but it's nearly a mandatory 10% on top of your wage goes into that from your employer, irrespective of who that employer is.
Okay.
So that's just the law. That's the way it's been for a long time. And that's sort of how things operate.
Sure. Makes sense. I think here, now different states have different laws. So, each state is able to mandate how employees are paid and what benefits they get. Some states very pro business. Some are much more pro employee. In the States, it seems the hardest hit industries right now are the service industry. The restaurants are big because a lot of waiters and waitresses, they work for tips, and some might make $1,000 a shift, let's say, but they get a minimal wage of $2 an hour, which is just pennies to pay into Social Security. They make $500, $1,000 a day, these great shifts, and then boom, it's gone. No money coming to these restaurants. That's what we're seeing right now. A lot of these restaurant type, small cafe, coffee shop businesses, which are kind of everywhere in this area that I'm in, hit hard. Hotel industry, things like that. If you're lucky to be a part of a big chain, a Marriott, Hilton, maybe there's a little bit of something. Retail, some of these more smaller boutique shops, things like that. $15, $20 an hour wages gone. And as you're saying, well, there is no money. So a lot of these businesses in the United States, they've fired everybody, allowing them to then go and receive what's known as unemployment pay. So the unemployment pay is essentially a percentage of what your weekly pay would be, which hopefully allows a bridge of the gap. How long does it take for that first check to show up? Question. Do you qualify? Another question. Not nearly as easy for people to just stay home, for sure. And I think before we move on, the ability to just, I'm sick, I might have a little something, I'm going to voluntarily self-quarantine would be such a huge measure if we could institute to slow down the process. And the next point I want to get it to, I think you were getting towards, is the concept of flattening the curve. As you were talking about, if everybody, 100 people, 10 get it, and then another 10, no problem. 50 get it. What if there's only 40 beds? 40 ventilators. So if you could talk and explain a little bit, what is this flattening the curve and this social distancing concept that we're all experiencing now?
Sure. So it kind of comes back to a fact that they call the RO, which is every person with, and I'm rounding the numbers and it does change on a daily basis, but basically every person with coronavirus will infect 2 others.
Okay. Wow.
If you don't see anyone else, you can't infect 2 others.
Yeah.
That's why they sort of, it is doubling at a decent rate. So to give you a concept, the gold standard for infectious virus is measles, which is somewhere between 14 and 16. So every person with measles will infect between 14 and 16 others.
Jeez.
So that's measles. That is the gold standard of how infectious a virus can be.
Yeah.
So at 2, we're talking about something roughly similar to influenza.
Okay.
Again, not my exact area, but it's about that. So the idea is you cannot infect people if you do not see them. And with they think that with the mild illnesses, we're also including people who are asymptomatic. There seems to be a certain percentage that don't get any symptoms, and so they won't know that they're passing on. We have a couple of these people that are being identified in the media as super spreaders. So they don't really have any particular symptoms, but are churning out a bunch of virus and infecting lots and lots of people. So in Australia, we've just had a wedding that 31 people got infected at a wedding. It was a few weeks ago, so it was really before we kind of had that awareness. But that's what's happening. So I have a little app in my for Melbourne for traffic that tells me how to get places and how to get public transport and things like that. And yeah, in terms of public transport, I catch public transport to work, and it's been awesome because there's been nobody on it. I was getting my bike ready to go, and I was going to ride into work because it's only sort of 5 miles and it's all good, but my daughter broke my pump. So I've got a new pump this weekend, so I'll probably be riding in, but I've been catching public transport. I don't wear a mask. I don't wear gloves. Essentially, my view on masks has been the same for a very long time, is they don't do very much to actually use them effectively, you have to be trained. So I worked with live HIV for 5 years. So I would consider myself trained, and I look at people using them and I go, that's not going to do anything. But what you are doing is if you're using those masks and you're not trained, those masks can't be used by someone who is trained.
Sure.
If you do have those masks and they are the ones, the best thing I would say is just contact your doctor or your hospital and say, I've got a box of these masks. Would you like them? That's something that I think we can do, because unless you're trained how to use them, they are tricky. They only last for a couple of hours before they get saturated and they stop really working, etc. and so forth. And the masks that you use in the building industry are not the same as the masks that you use in the medical industry, and there's a whole bunch of rules. So that's my little rant on masks. You'll also never see me wearing gloves on public transport or anything like that. I get on, I do my stuff, I get off, I wash my hands.
Okay.
It's really that simple, because I've been touching my face because I've got allergies and I've still got the end of this cold. I washed my hands before I started this, and I'll wash my hands afterwards. I'm at home. There's probably not that much need, but again, I'm getting myself into that habit, so it doesn't really matter. Sure. The other thing is with hand sanitizer, which has got 60% alcohol or above, will work. Anything less than that won't. But the best thing, overall, the best thing for washing your hands is boring soap. And it doesn't matter whether it's your organic tea tree soap. It doesn't matter whether it's your Lego soap for your kids. It doesn't matter whether it's the cheapest, Target soap you can buy. If it gets a lather, it's going to do the job beautifully. 20 seconds of washing.
Does it have to be antibacterial soap? No. Okay. Thank you. Okay. Good to know.
So basically, soap's a detergent. You know how you wash your dishes and you know how you get stuff that's really oily? What the soap does is essentially it separates the oil, breaks it down, and makes it dissolvable in water. The great thing is the outside of these viruses, it's called an envelope virus, is fats and oils. Like HIV, for instance, 15% of the entire weight of a HIV virus is cholesterol.
How about that?
So you've got all these fats and oils. It's like a soccer ball or a dodgeball. I'm trying to translate into American as I go. Yeah. And essentially that leather on the outside is just fats and oils. And so if you use detergents on fats and oils, it breaks it down and it can't do anything. You can use your dishwashing liquid. You can, you wash your clothes with detergent. So there's no worry about virus being on your clothes. The simplest, dumbest detergent will work. You're washing your hair with detergent, with shampoos. You're washing your soap with whatever. It does not matter. If it gives you a lather, it's going to be fine.
It's so interesting. I've never heard that before. And just to give an example, the last couple of weeks, so I kind of saw this coming on, right? You see the news reports, things are going on. We're a little bit of, not a prepper, but we have lots of, food in bulk, and just for a healthy lifestyle, we have nuts and seeds and oats and rice and things like that. It's normal. Good water storage. We filter our water and whatnot. But I was like, well, cleaning supplies. And I noticed all the antibacterial soap disappeared. All the soap that didn't say antibacterial, full stock. Nobody would buy that. Nobody would buy soap that didn't say antibacterial, only the antibacterial, because the assumption is, well, if it's not antibacterial, it won't wash the bacteria or virus or anything else. So I guarantee there's people buying bleach instead to wash their hands instead of the soap, which will do the same darn job and be a heck of a lot less harsh on the human skin, right?
Yep. And that's the thing. It's like I've got different soaps. If you go into a laboratory that does testing, they don't have hand sanitizer. They've just got liquid soap. It's not fancy. It's medical grade just because it fits in the squirty bottle.
Sure.
But that's it. It doesn't have to be fancy. It is just as simple as any kind of soap will do. Wash for 20 seconds, you'll do.
And 20 seconds is just to ensure that you've completely lathered. You got every part, every nook, every cranny. It's had the time to get in there, do the job, and wipe that envelope off, essentially.
Yeah, and basically it takes you that long to actually make sure that you've covered the surface area of your hands. That's kind of where the 20 seconds comes from. It's like by the time you've done the fronts, between the fingers, the back, the bits that you missed, there's some really great YouTube videos where someone's wearing gloves and they put black ink as the soap, and then they wash, and you can sort of see the bits they miss, and then why the different hand motions do different areas and things like that. And it's 20 seconds. It's, there's also a great series of memes with all the different songs that you can do. I've actually taught my kids' kindergarten class, and we do it to the tune of Happy Birthday.
Okay.
You wash your hands to the tune of Happy Birthday. By the time you finish Happy Birthday, you've done your 20 seconds.
Done. Easy. That's excellent.
Yeah.
Now, another question, transmission points. At first, I think someone was on the Joe Rogan show and he maybe misspoke or was misinterpreted, where he basically used the term airborne. Now, the coronavirus is not airborne, although maybe you can explain it way better than I'm going to do a terrible job here.
So I was actually reading something about this. They are investigating whether it's airborne because it is so infectious, but there is no evidence that it is. But basically, things like influenza and measles, they can live out there in the air, and they can sort of stay in the air for quite a deal of time. So no virus is actually airborne. It doesn't. They can't fly, but what they can do is they can stay in the air for a decent amount of time. So the general thing we use in a lab for a safety thing is if we have a spill of anything, we leave the room and shut the door for 30 minutes.
Okay.
So essentially we allow 30 minutes for anything to pretty much let gravity. But, and that's what we're talking about airborne. We're not talking about something that can just land on the air forever. It's like if there's a wind, it will stay up longer. If there's no wind, it will drop down. So that's what we're talking about. And so there is no clear definition of what airborne is, because somebody sneezing, if it takes 5 minutes to drop versus 10 minutes versus 15 minutes versus 20 minutes, it's sort of exactly what is airborne. It's sometimes used to talk about, someone can sneeze in a room, 5 minutes later you walk into the room and you can get the virus. It's a ballpark, very, very loose term of what we mean by airborne.
Okay.
So that's sort of a terminology thing, and that's one of those things that there is no clear definition, but it's just sort of a loose thing, whereas most other viruses, you need direct contact. So, for instance, the viruses that call gastroenteritis and diarrhea and things like that, you need to have a direct contact with the virus, and it needs to end up somebody attached to your alimentary canal. So basically your mouth, your nose, somewhere like that. Does that make sense?
It makes perfect sense. Yeah. So the airborne essentially is maybe it's someone inhales a cigarette, they blow the cigarette out. You can see the smoke. It's still in the air, but eventually it dissipates. Now the virus essentially kind of will fall to the ground. Gravity, the smoke will tend to kind of maybe rise and dissipate and be, completely diluted. Same concept. It's going to take a little time. And grocery store, I'm in the grocery store. I'm walking down the grocery store. A guy 10 feet in front of me coughs or sneezes. If I don't make a quick turn or about face, I might walk through that slowly dispersing cloud and I could get it.
That's exactly right. And I mean, I guess sort of related to that is the other thing is this. I had a lot of conversations with my staff over the last couple of days, and there's been a few things. So whether your virus can be on your clothes was a question that came up, and we said, possibly, but if you wash your clothes in detergent, it's null and void. The other thing they were saying is I can live on surfaces for long periods of time.
Yeah.
So firstly, that was done in a lab and it was done in controlled conditions. So they were asking about playgrounds because they're saying it can live on metal.
Yeah.
So, I mean, if your kid, is playing on playground and someone's just sneezed on it, yes, they can transmit it. But do you know what we actually use for getting rid of viruses a lot of the time is UV light. So if you're out there and there's a playground and there's wind blowing around and that can actually break down the virus, you've got a decent sunny day to the point where, your kid's wearing sun protection and things like that. It's a big thing in Australia.
Yeah.
That's going to break down the virus. So again, it's like we take these things, they are factually true, that it can live on copper, I think, for 12 hours.
Okay. But
again, that's in a very controlled environment and there are various different factors. Obviously, every 6 hours someone comes on and sneezes on their copper. That's another confounder. But if you've got lots of sunlight and lots of fresh air, that's probably your best way of actually dealing with a lot of these sorts of things at this stage.
Isn't that funny that sunlight, fresh air, washing your hands? This is old. This is grandma's advice on how to live a healthy life, right? And it's so relevant today, even.
Yeah, and that's the thing. Is like none of the microbiologists and people that specialize in this are doing. They're making minor changes, but they're not making major changes. They're always been about washing your hands. They're always been about sort of not cross-contaminating things. It's like, you know, I'm very particular about which chopping boards I use for which kind of things. I have a chopping board for meats and a chopping board for vegetables. And that's just basic contamination control. And we're sort of, you know, I don't wipe them down with water. I wash them with detergent. Again, it's the same thing we've been doing for a long time. The social distancing is something that's new. And the reason is because we can do it. When everybody was working in a factory 50 years ago, you can't do that. You can't take that home. Whereas, you know, my wife's a consultant and she can do a lot of her work from home. She's doing meetings on Zoom and things like that. And there is an ability to do it without actually having huge economic disruption. And so, I mean, I was talking about the app that looks at public transport and traffic. I got sidetracked as I normally do. And we've sort of seen in the last week, we went from Melbourne was at about 97% of usual traffic. And we've dropped within 4 days, we've dropped to 50%.
Wow.
And we'll get feedback again today on that app. It gives it twice a week. And I imagine it's going to drop even further.
Sure.
So these measures are doing this. We're seeing some fantastic innovations. We're seeing that, I'm sure you guys probably created it, but things like Uber Eats and Grab and Deliveroo and all those sort of home delivery services, they're doing all of that with no touch. So they'll just leave it and then they'll walk away and then you'll pick it up. All of our local cafes are doing it. We've got apps where I can order my coffees or my drinks from the cafe. I'll drive by 5 minutes later and often the guy will just hand it to me in my car.
Yeah.
And that's sort of reducing the no touch. We're doing all those sorts of things. And we're really actively trying to keep buying coffees from the same places so that they can stay business. We have a different payment. We don't have the tip situation. But we also know that countries like the UK have, I think, guaranteed 80% of wages for workers. Wow. And that's going to be paid by the government. So that's incredibly generous. And I don't know if Australia's going to do that, but yeah, they're trying to, the effects of the virus will last probably 3 to 6 months seems to be the general idea. And again, that depends on flattening the curves and it depends on, you know, if you've had seismic changes to your infrastructure and things like that, it will take longer. But then we all have jobs and those jobs require people to pay money for whatever it is that we do. And if people don't have that money, then it all sort of, it comes to a grinding halt. And that's why they're sort of, you know, our government's just announced this morning, they're doing another sort of stimulus package, which is our stimulus package is up to just under 10% of our gross domestic product, just to really kickstart our economy and keep things kind of going. And yeah, we're going to see more and more of that. I know I've heard from the US, there's $1 trillion things because, you know, whatever we do, you guys do it 10 times bigger because, you know, you're the US.
Gotta go big, brother.
And that's what we'll see. And so I guess, you know, what I'm doing on a personal level is that I'm not a prepper. I just forget stuff and always have a bunch of stuff available. And we eat a very varied diet. So, you know, we'll have, you know, rice bowls with brown rice one day, and then we'll have homemade pasta the next, and then we'll do all sorts of different things. So we tend to have a lot of variety, which has sort of insulated us. We've had no problems with fresh fruit. I do have a great explanation of why everyone's running for toilet paper.
Yes, I can't wait.
So I looked it up and I sort of heard it, but I confirmed it before I came on board because I just wanted to make sure it was correct. So one of the first places hit was obviously China. And then immediately after that was Hong Kong.
Okay.
So Hong Kong is sort of a separate area. It's run differently, but they've also had sort of independence riots for the last sort of several months. So they've sort of, they got handed back to China from the UK in 1997. And now sort of, they're getting to a point where they'll actually be rolled into the normal Chinese government. And a lot of people are not happy with that. It's a bunch of political stuff I'm not going to go into, but basically they had riots and there's been tension between China and Hong Kong. On February 7th was the news article I got when China, they sort of had their first couple of cases of coronavirus in Hong Kong, and they were worried about the Chinese government sort of using this as a lever to sort of push Hong Kong into, you know, subservience. And so they thought they might shut off the supply of things. Hong Kong doesn't make its own toilet paper. So they were very worried about essentially China politically using this as a pressure point to really take out their sort of democracy movement by shutting off the supply of, there was a bunch of things. So I can't remember the other ones, but toilet paper was one of them. And so you saw all these people in Hong Kong grabbing toilet paper, which was it was unfounded. I will say it is unfounded. China didn't do that, but there was a very real and there was a historical of why that was happening in that place at that time. And coronavirus was only one layer upon it. So everyone else saw that and went, oh, let's stock up on toilet paper. In Australia, it's possibly even more ridiculous. We have huge amounts of toilet paper. We have huge amounts of trees, and we actually export toilet paper. Wow. So we have as much as you could possibly have. But we're still, there's been no toilet paper in the supermarkets. I'm going out to my elderly parents this afternoon with some toilet paper for them, which is frankly ridiculous, but because we get recycled toilet paper, a great Australian company called Who Gives a Crap. And
excellent
they 100% recycled tissues, toilet paper, paper towel, and we get a delivery every month. We got our delivery on Friday, and we've normally got too many, and so we're actually just putting a basket on our front fence saying, if anyone needs toilet paper, grab some. And we're seeing a lot of really good community. There's a lot of people going on Facebook Marketplace saying that I've got some toilet paper. If you need I'll limit it $2, 2 rolls per person. And if you need me to, I'll deliver it, and it's free. And it's just about sort of community looking after each other. Our local Indian, which in Australia means from the country of India, there's no racial overtones with it here. Sure. They're offering a free meal to every person over the age of 65 until this finishes.
Wow.
And it's a proper free meal. So it's, whatever, you get to pick which curry, or whether it's vegetarian or meat or that, and you get a side dish and things like that just to support communities. So we're actually seeing some amazing things and really people coming together and coming up with innovative ways to actually help the community. And so there is, you're asking how this could change us. I think that it could change the way we work. It could change, it's definitely having effect on our environment. Now, they talk about the Venice canals no longer being polluted. That's actually just silt. If you're not churning up the silt, it's sort of, but it's certainly having effect on our carbon emissions and things like that. And whether you're I think the evidence supports climate change. And I think that if we can deal with that, that's a great benefit. And this is showing us how we can. So we'll probably not go exactly as hard as we're going to in these sort of different lockdown measures, but it will show us how we can do things creatively and innovatively. And one of the great things that I've seen going around is someone sent a picture that said, we'll finally get to find out if that meeting could really have been an email.
That's great. 2 points that I'm very appreciative, because I got, some business associates that are friends in Australia, and we got on a call 2.5 or so weeks ago. And we were joking because that's when, for the first time ever, the Australians were actually acting a fool, and it wasn't the Americans. And I finally, because of course I'm the American guy, so it's easy to beat up on me about my culture or whatnot, but for the first time, because they were like, man, it's crazy. These people, it was like really kind of just 3 weeks, a month or so ago, it was getting pretty crazy. And that was being played over here on the American media. Like, can you believe what's going on in Australia? And all our stores were still filled. Nobody was doing it in here yet. But monkey see, monkey do, right? So the Australians saw it from those in Hong Kong, essentially, right? We all of a sudden saw the Australians doing it. And I noticed over the next 2 weeks or so, it was gone, to the point people are getting into fist fights, trying to buy pallets of toilet paper here again. America, we got to do it bigger than you guys. So we got to get into big fights over, 40 gallons or, 40 cases of toilet paper. So it was nice that you guys were able to lead the charge on kind of the embarrassing toilet paper issue.
And I think the thing is, the one thing that makes it, Australia and America quite set up is we generally actually have bigger houses. So yes. It's worse in the suburbs of Melbourne, where people have bigger houses and more room. It's nowhere near as bad in the inner city, where people have apartments, and there's, you cannot stockpile a year's supply of toilet paper without it actually affecting your ability to go into the dining room.
Sure.
It's one of those things. And so, yeah, we have really close connections with Asia, and we have a lot of people going back and forth from Asia. So actually 3 of my staff are from Hong Kong originally.
Oh, wow.
They're all
Okay.
Australians, but that's
Sure.
sort of what it is. So we're aware of that, and we see those things, and there is that link. But yeah, it was apparently it was like having the week before Christmas 3 weeks in a row.
Yeah. It's funny you say that. The supermarket I go to, you get to know the staff, be friendly and what's fresh today, Joe, and all that stuff. And he said, listen, this is it was like the last week of February, first week of March was their best 2 weeks in the 12 months of the year prior. He said, I don't know if it's the best it's ever been, but we just did a 12-month analysis. Those 2 weeks, and those are two, he's like, these are two of the these are nothing throwaway weeks. There's no holidays. There's no events. There's no bad weather. It's no big deal. Better than Black Friday, Thanksgiving here in the States, Christmas holiday, all the big buy your turkey, buy your potatoes, all the big holidays. He said, we did the best numbers we've ever done. And that to me was scary because that showed that the panic, irrational buying was really starting to peak. And you might have noticed also, because you're, a clean eater, all the healthy stuff it was pretty easy for me to do my shopping.
We've got no problems. All
right?
The fresh fruit and vegetables, as much as you want, wherever you want, no problems at all.
Yep.
The things that, there's toilet paper, there's a bunch of, we're getting shortages on rice, but,
yeah, us too.
We sort of, we went shopping yesterday for the first time in several weeks because, we just kind of thought we'll ride it out, and it seems it's peaked in Australia. So we're not getting those kind of manic things anymore. And because we don't have a huge food shortage, that's the whole thing. There is no real shortage. So we went through the supermarket with my family yesterday. We could get everything. We got brown rice because we tend to eat brown rice, but you got as much white rice as you wanted. There was different pastas. There's maybe not the 50 different types of pasta, but there was certainly pasta available. We got everything we wanted. We got some canned tomatoes, and they're one of the other things that's been going heavy. But
sure.
Yeah, it wasn't really an issue. And I spoke to the guy at the checkout, and he was kind of going, yeah, it seems that everyone is stocked up now, and they're kind of going, oh, okay. So got everything I could possibly want, and now I'm just chill. But yeah, my kids eat a ton. Like we made a fruit platter yesterday of what we had around, and it was like 6 different fruits. So we had kiwi fruits and peaches and bananas and apples and pears and all that sort of stuff. And we've had no problem getting that. We've had no problem getting milk. My wife can't drink cow's milk, so she drinks soy milk, and she's had no troubles getting that. And by that, I mean she has the milk that she uses for her coffee, and then she has her other milk because she's pernickety and she wants this particular milk for coffee.
Sure.
No troubles at all. And so what we're looking at is that I will give hope to anyone who's watching this that we've seen it come early in Australia, and we're sort of seeing it sort of chill out, and everybody actually just kind of going, all right, well, I'm prepared and everything like that. But it's not the end of the world. And there is, I can certainly speak to Australia, and I imagine America it's even more so. There is no shortage of food. Okay. There is no, and I mean, we've also had bushfires, we've had droughts. Our actual rice crop in Australia is the 2nd lowest on record. And yet, in spite of all of that, we don't have a problem because guess what? We export rice.
So you have a high supply. That's excellent.
Yeah. I mean, Australia is bigger than the continental US. So we pretty much produce a lot of different things, and there's no food shortage, and there's certainly no fresh fruit and vegetable shortages. We've had quite a few vegetarian meals just because that's what we tend to have. But there's also, there's all, we went and got different types of lean chicken. We got, some thinly sliced beef, and had some Korean bulgogi stir fry last night.
Well, these are first world problems, rice. My friend.
Yeah. It's
right.
Like, I mean, I've been a poor student. I've had the 8-cent cans of baked beans and these sorts of things. And you can get your nutrients if you need to a variety of different ways. I haven't had to change the way I'm cooking. Sure. And to be honest with you, I'm a pain in the ass to cook with because I like all different things. And I like variety, and I like flavor, and I like fresh stuff, and I like textures and things like that. And I haven't had to change any of that.
I love it. All right. So now where we are right now. So right now, the US is pretty much, it seems like more cases every day. We're getting towards that peak. We've started a week or so ago practicing social distancing. There are curfews in most every state now, 8 p.m. The curfew states have become now to kind of voluntary isolation, self-quarantining. I forget the name of it, stay at home. State governors now, we have 50 states in the country, the United States. Individual states now are starting to institute stay-at-home laws, basically a month or so, saying for the next month, you have to stay at home, stay near your property. You can go out for walks. We want you to walk, but do so by yourself or with your nuclear family, not in groups. Don't go play sports. Go for a jog, a walk, a run, but do it away from other people. Be out in the sunshine, breathe the air. Don't touch things. Don't go to parks. Kind of out, move your body, and then go back home again. Sit in your backyard, essentially. The social distancing side of it. Non-essential businesses all shut down. They have kept, hospitals, pharmacies, supermarkets, grocery stores, gas stations, car shops, mechanics, and such. Liquor stores, of course, are very important. So the liquor stores are still open, which, I guess you need. Outside of that, most every other business is pretty much shut down. So extreme social distancing now is kind of the next stage outside of martial law. That's where you have soldiers with guns in the middle of the street. Don't see that happening here. In the area I live is everyone's pretty much taking this very seriously, which is outside of the 13 to 17-year-old children, that
yeah.
That group, but they're going to do the opposite of what mom and dad say anyway. Outside of those, they're probably the super spreaders, I'm sure. So now that, the vast majority of this country, the world seems to really have woken up taking this seriously. And I do want to touch on Italy and Spain after this, but from this point now, what do you see happening from where we are, what we know about the last 85 days, what South Korea, what China, what Germany, Denmark, what some of these other countries have attempted, what has worked, what may be a little good, maybe not so good, as far as what we're doing right now with the extreme social distancing, with everybody agrees, save lives before you save businesses. So there are, lives to go back to these businesses, essentially, is what one of the politicians said, to which I agree right now. But now, what's the prognosis 3 months from now? What are we thinking 3 weeks, 3 months from now, a year from now? How is this going to help us, or are we just really throwing it up in the air and not sure? I mean, what do you think?
So I think that what my understanding was, and every country has its own nuanced approach, and there's different things that will happen. So, in Australia, they're going, they didn't shut the schools in Singapore. But what they did was they took a temperature of every child turning up to school. So it's it's not, when you hear things like that, it's not quite as clear cut. What I think, and maybe this is my personal bent, is what the difference is testing.
Okay.
We generally we haven't had a good idea of how many people, because most of the tests have been quite manual. And the US had a major problem where the CDC designed a test that was flawed.
Of course.
And so that means that, and I think I could probably make an argument to date, the US doesn't know how many infections it has.
No, with numbers I've heard from, I think the leading health official in Ohio seems to be the most, informed state right now. It's kind of leading the charge. Said their anticipation is whatever the number is, it's 10 times. So what we know, what we assume, where it's 10 times the cases. And then she did build a silver lining in that, saying, and if that's the case, the fatality rate is considerably lower than everyone is saying right now. That made immediate sense to me, because we know who's dying from it. We can tell that very specifically. How many people have it, though? For everyone that has it, 10 people likely do have it, or maybe just had it. Would you agree?
Yeah, I mean, I think the thing is, there's always the caveat on all of that is, if you have 10 times as many people have it today, but they've only got it today, what are we going to see in 14 days? And that's, that's what the social distancing, it actually buys us that time to work out those equations. But I mean, what has really changed in the last week that hasn't got as much information as it should have? But prior to sort of last week, we had one company making, we had a couple of others, but I'm aware of one company that was making 100,000 tests that were highly automated. By highly automated, I mean you can do 500 tests a day. It's a long day with 2 staff, and that's it. So as of last week, a company called Roche, which is a huge multinational, does a lot of diagnostic testing, brought out their high volume test. Excuse me. And I've got one of these machines. We do 1,000 a day with 2 staff. So they've come out and they're going to be creating millions of these tests a month. A company in Korea, the one I said, is making 100,000 a day. As of 3 days ago, another US company called Abbott, which is based in Chicago, they think by the end of the month they'll have 1 million tests, and they'll just be ramping up from there. So what we've actually moved in is we've now got, this Roche test, 3.5 hours. So suddenly it's we're making it faster and we're allowing it to be scalable. There's another company called Severity, which does the point of care flu tests.
Okay.
And so if you go into hospital during a normal flu season, you've got the symptoms, they'll take a swab, they'll give you a result in 30 minutes. If you've got flu, they'll put you in a special room to stop you spreading it. They think they'll have their coronavirus 30-minute test available mid-April.
Wow. Huge.
So it is my bent on things, but I think that having accurate, timely, fast, automated, high volume. So using that machine in Australia, judging from the amount of machines we have, in Australia, we'll be able to test 50,000 people a day based on our diagnostic capacity. Obviously it's about getting tests into the country and things like that, but we have the machines, we have the staff, we can do 50,000 a day. So what you're looking at is you're probably looking at, every 3 days, every 4 or 5 days, you could test 1% of the population.
Wow.
That's a testing that you've never had in the world ever. So we do have that capacity is actually coming online. Again, 85 days since we first identified the virus, they were able to create, test, and get FDA approval. Because that's the other thing, these 2 US ones and the third one coming along, FDA approval. They're also manufactured in the US. So the Roche one and the Severity one are manufactured in California, in Silicon Valley. So again, great for you guys. You're not going to have to go anywhere. You're not relying on anyone else. All the swabs that they're using mostly for testing are actually from Italy, but although Italy is shut down, that factory has changed from doing all the different products to doing 3. For the purposes of this, so that factory is going at full ball, and that's what they're doing.
Okay.
So what's happened with Italy, what happened with a lot of the other countries was we didn't know how many people were infected. And if you don't know how many people are infected and you don't really have an idea, and there was an element of, I'm choosing my words carefully, that things that happen in China are perhaps not as applicable to the rest of the world for a variety of different reasons.
Sure.
Initially, and then that's clearly gone away. And also, the quality of the information coming out of China has and is being questioned because obviously you have a government that can control the media very easily. Italy has sort of shown that, they didn't know how bad it was before they acted. So places like Australia, certainly, we've got the advantage of being an island. So we've shut our borders.
Yeah.
We've sort of got all the social distancing and things like that. We've probably got to a point where for a long time, nearly all of our cases from overseas, and the biggest country was the US. So thank you.
You're welcome, of course.
But we're pretty sure that now the cases are starting to circulate in the community. We've just topped 1,000 cases in Australia, and we've done a lot of testing. So we've done, I think, at least 100,000 tests in Australia.
Wow.
So as a percentage, we've been doing quite a lot. We've got one of our smaller states. We've only got 6 states, but one of our smaller states has been incredibly innovative. They've done a higher percentage than nearly anywhere else in the world. They came up with fever clinics. They came up with drive-through. So essentially you just drive along, someone in protective things takes your sample while you're in the car, roll up your window and away you go. And to be honest with you, would I prefer to sit in my car for maybe 20 minutes? Great. Listen to a podcast.
Yeah.
I'm not on the road, so I can check my phone, all those sorts of things. And it's just really people coming up with incredibly smart and really logical ideas that you just kind of go, Well, yeah, I mean, we can, and I know the US has drive-through blood banks. Why could we not just do this for a simple nasal swab? So I think we're going to see some really good innovation. But at the moment, the question has always been the amount of people that could do testing was very small. The US actively discouraged it for whatever reason. In Australia, we never actually discouraged it, but there was sort of, there was only so many labs that were allowed to do it because of, legal accreditation. That's now off now that we've got these mass manufactured tests. So in my lab, if I decide to do it and we're not, we could buy the test, get the test in at 9 o'clock in the morning, do a run to just check that it's doing what it says on the packet, and be testing patient clinicals, getting clinical results by 5 o'clock that day.
Wow.
That's the sort of turnaround you're looking at. And with these point of care tests, which are the 30-minute ones, the machine is 10 kilograms, so 20 pounds.
Oh yeah.
I've actually carried 2 of these in cardboard boxes to Malaysia in my carry-on luggage. It's really easy. You just plug it into a PowerPoint, you put the test in, you press play, you get a result. It's like a coffee pod.
How about that?
So the technology is there. We've been able to adapt some of the stuff we use from flu, which is about quarantining cases with infection. We've got a problem where we've let it go for a certain period of time, and now we can actually act on it. But now that we can actually know who's got it and who doesn't have it, and we have the ability to just mass test groups and communities and sort of clear it out of one area and another, that's when I think we'll be able to have the success. I think that, from what I've seen, 3 to 6 months, it's not going anywhere. The one question we have, and it's not intended to scare anyone, but we don't really know, is how long immunity will last.
Yeah.
So if you get chickenpox, you'll never get chickenpox again. But other things, if you get whooping cough, you can get whooping cough again sort of later on. You don't get immunity for life. So exactly how long this lasts, we don't know. Obviously, 85 days, even if you're doing a research study, you wouldn't know. There's only one case of someone getting it for a second time that I'm aware of. And that was a very elderly person back in Wuhan. And we know that the immune systems of those people tend to be compromised. So it doesn't really give a clear picture.
Sure. Interesting. And that's, I know the UK initially was focused on creating a herd immunity, and then kind of the beginning of that process, they did a pretty quick about face, it seems, and switched over to the social distancing. Do you have any thoughts on that?
Yeah, so I mean, there was a paper that came out that just sort of said, yeah, you can do this, and yes, herd immunity can be built and all those sorts of things, but you're just going to kill a disproportionate amount of people. And
there you go.
And they got the paper and they went, oh, yeah, let's not do that then. And so it was one of the things where it was a creative idea. And again, I'm not a British, I am actually a British citizen, but I'm not into British politics. But the current government seems to be a bit strange. Okay. But when they got evidence to the contrary that their plan wasn't working, they changed it. And that's something that should definitely be applauded. And
yes,
although politicians tend to have a thing about changing their mind because they'd be accused of flip-flopping, it's really good to see that when they get new evidence on something that's as fresh as this, they change their mind, they change their policy, they change their approach. And that's something that's actually really good to see.
Absolutely. And that should be public policy. It should be evidence-based, not emotional or opinion-based, right?
Yeah, and I imagine, most countries are like the US and Australia, in that we are quite politically polarized at this point, and so people tend to go for their own color. But this is something that's actually we've sort of seen in Australia, that sort of partisanship has disappeared, and there's been really, really good support. On a side issue, while I remember it, because I won't, is there's been an announcement in the US about 2 drugs that have been used for treating this.
Yes.
Basically chloroquine, I think it is, and a version of that. I've looked at the paper this morning before coming online, and it's very patchy. And I think Dr. Anthony Fauci, I think as your head, has said that it's anecdotal. And to be honest with, having looking at that's a very generous interpretation of it.
Okay.
A lot of the people in the control that they said, didn't have viral loads, they didn't test.
Interesting.
So it's I wouldn't, although it was announced politically in the US, I would really, the Dr. Fauci is an expert, and I have the utmost respect, and I know a bit of his work from previously, and you've got someone really good at the helm there.
Well, that's it. He is, when you hear him speak, he's reassuring. And as he is a guy that says, we don't know yet, we're working on it. And that's refreshing to hear as someone who is honest to say, we don't know. And you can see the a little bit of the fear, but also the passion in his eyes that this is a guy who's probably working 50, report he's working 15 hours a day on this. He gets his hour run in every day to make sure he's fit and healthy, and he's in there getting after it. I did want to ask you also, is there a unifying global body that's leading this charge, or is it each independent nation is doing what they independently think best, and then they're kind of sharing this information to each other to see what's actually working or not? How does this globally, because we are very much a global one world now, how does this actually all sort of integrate together?
So, I mean, we have the WHO, which is the World Health Organization, but I think the problem with that is that it's an organization from member countries, and things are, in Australia, we've had 3 changes of policy in a week.
Okay.
And just, it's been stepping up and up and up. Yeah. And we've certainly seen that in the US, and I've seen it in different states, and even different cities have different approaches. And I think that at the moment, we haven't got to a state where getting everyone to get on board and have a meeting and have all the different people, we don't have that sort of consensus to be able to run it like that yet. So I think that at the moment, if the WHO can't do anything unless it's got input from a bunch of different people, so it slows down the process. But in Australia, and I imagine it's probably similar. If we decide that we're shutting our borders, which we have, that's it. We've shut our borders, and if they want to make it in 10 minutes, they'll make it in 10 minutes, and then that's it. That's the end of it. Okay. Whereas for the WHO to do anything, they say something, and then even down the line, it has to be enacted by the different countries. So at the moment, New Zealand, which is our sort of closest neighbour and is a very forward and progressive country, they came up with the 2 weeks isolation when you travelled. We stole that unabashedly about 2 days later. And we're trying to steal any good ideas from anyone else. And I think that is absolutely the best way of doing things. They're doing sort of social isolation that other people have done. They've come up with their own sort of version. So an interesting thing they've done for us is they've said each person should have 4 square meters. So 2 meters by 2 meters is about 7 foot by 7 foot, which means that all these coffee shops and venues, their capacity is deeply reduced because, if they've got 40 square meters, they can have 10 people in there. Yeah. And that's a way of sort of enforcing social discipline that I hadn't heard of before. And, there's all these different bits and pieces that people are trying, but it's so fluid, and each country has its own problems and their own, different, things to deal with, that it's just moving too fast to have somebody leading the charge. WHO got to the point where they made an emergency and they made it a pandemic. Once they ticked those boxes, it gave a lot of countries free rein to make emergency actions and things like that. So at the moment, they're sort of looking at things and they're trying to come to consensus, and they'll probably release things on which drugs work and don't work as the information comes out. But it's just going to be a bit slow considering how rapidly this is actually changing.
And on the front lines now, it seems to be outside of maybe the governmental WHO and U.S., Australia, the individual governments disseminating the information. A lot of the brain trust really seems to be in the private sector. The Roche, the Abbott, the Subfields, these companies are out there trying to figure out, let's isolate, let's figure out how we can create a vaccine. Let's figure out how we can create some sort of antiviral medicine. How can we come out with some sort of test, some sort of maybe mass produced faster mask or latex glove, whatever that might be. That really seems to be the private sectors now that are being, re-engaged probably with a lot of governmental funds on these contracts to get in there and get after it. So there really aren't governmental agencies, and just my opinion, most governmental agencies I'm aware of are very slow moving and very clunky. Lots of middle management in between getting things, slowing the process. where the private sector can be a lot faster once they have the cash to make things. Amazon's a great example. Amazon's keeping this country running right now with the grocery delivery, the food delivery, getting everything done. My street is Amazon trucks all day long, more than minivans. I see Amazon trucks driving my street every day now, so it really, and the question is it really kind of up to the private sector in many ways to find the drugs, find the vaccines, find the antivirals, find the testing, and get ahead, then give it to the government, or get it back to the government, the medical institutions?
So I guess there's a step that's kind of missed in there, and that's sort of the actual labs. And so some of those labs are government labs, some of them are medical research institutes, some of them are universities. Essentially, if you look at Roche, they've got development labs, but they don't do that much development in there. They actually get it out. So, Roche created a particular HPV, human papilloma test, and then they had to get a clinical validation for it. We did it in my lab.
Okay.
So what happens is whether it's the government departments, I would agree with you, but actually a lot of government labs are the ones that Roche is going, oh, what do we need? Because Roche doesn't have a coronavirus guy.
Yeah.
They have people who are good at technology and things like that, but they'll go to the experts. So, in Australia, if you've got a new chlamydia test, you go to this guy. If you've got a new gonorrhea test, you go to this person who's actually a woman. You go, there's everyone, and for every particular thing, there's different places in the world. So a lot of public health laboratories, so the government labs, are actually giving a lot of the information that is helping these assays develop. The government departments are not involved in it too much at all, but the actual government labs are the ones that are seeing the patient. They have the samples, they have the genomes for these targets that allows the Roches to develop. These are the targets we want to go. These are the primers. This is the technical jargon. And that's where it is. So I think that is a step where your medical research institutes and your government laboratories are absolutely contributing, but it is the private companies, because you're trying to get a government to make a vaccine, trying to get a government to make a diagnostic test is just never going to work. I'm not aware of any government that's any good at it. Whereas the private companies, because they can do all of these things, they can put it in there. And the other thing is they'll sell it. It's a very good business decision. I think that my personal view is that it's these combinations of experts in the field and companies which can actually take a concept and make it mass produce are where we've actually got massive benefits than we have in any previous event like this.
Yeah. Interesting. So now, to kind of move towards closing this, and I thank you so much for your time. As we are now, what do you think? Where are we going? And for the people at home, what should the average person listening right now? They have their job, they have their spouse, they have their kids, they have their family. Maybe they're a student, or they got their first time home. The average human right now listening to this, what should their expectation be over the next few weeks to months? And then what does life look like, as it continues?
So I think that it's, I'm a middle-class, middle-aged white guy with a job with benefits. I've got my own house, I've got a mortgage, but I have my own house. For me, the equation's pretty simple. My job will probably mean that I go to work even if there's a shutdown. My kids will stay home. My wife's a consultant. She will be able to work from home. We've already got stuff coming from the schools about home education and things like that. My kids are relatively young. It's not going to be the worst thing if, their learning rate isn't quite as catastrophically high as it normally is, because, at 6, they can pick it up. If I was doing what they call the SATs in the US, if I was studying for my SATs, I would be pretty stressed.
Sure.
But I guess those things will sort of come out. I think that what we're going to look at is that we're going to establish a steady state of where we are as a community. So if we're going to have social isolation, we're going to have it for a reasonable amount of time, because if we do it for 2 weeks and then we come back out, then we'll get infections. One of the processes they're looking at, which they think could be the most successful, is have social isolation until we have no cases and clearance. So at least 2 weeks with no cases, and then just monitor the hell out of everybody so that when those cases do pop up, we can monitor and trace them. And while you're able to trace infections, you could really control it. And so there's different things. There could be shutdowns for sort of 6 months where no one can do anything. That's pretty catastrophic to the economy. Whereas the one that sort of I've seen presented that seems to make the most sense to me, and again, even if it was absolutely 100% the most scientifically valid, I can't guarantee that it would be palatable politically. So again, that's sort of where there is a variation that I can't control. But yeah, the idea is that, you know, in China, they've essentially got down to only a few cases, and they are tracking and tracing every single one of those cases.
Okay.
And why you can do that, it's controllable. But at the moment, I don't think there's too many countries where you can say that it's controllable, and certainly not sort of the Australias and the USs and the European countries. So I think that what we'll see is we'll have a lockdown until we sort of have a halt of community transmission. So, you know, if you're not seeing anyone, you either can't get it or can't give it. So all the people in your household will get it, or they will never get it. And then from there on, then we can sort of move through. But again, I will state, I'm not an epidemiologist, I'm not an infectious diseases doctor, but what I have read of the models, that seems to be a pretty logical, and it seems to be at least trying to strike the right balance between infection control and economic management. And I think that, you know, I'm not an economist, but even I can sort of see that everyone losing their jobs is bad.
Yeah.
And so this is how I think that it's probably going to go out. So we will have these shutdowns soon, and they will be hard shutdowns. So yeah, you go out to the grocery store, you go out and do the minimal amount of things possible, then you're at home. Yeah. One of the journalists who's been living in Italy, she goes out once or twice a week, and that's it. And that's for her entire family. And then once things settle down, then that will change. But yeah, I mean, it is a virus. It can cause severe disease in some people. It won't in most people. But I have elderly parents. My dad's had, you know, used to be a 4-pack a day smoker and a 15, 20 pint a day drinker. And so he's had 2 heart attacks and 2 strokes and has emphysema. So, you know, he is clearly the poster boy for people that you do not want to get that. Yeah. So I'm running out and I'm seeing them today before it's community acquired, and then I probably won't see them. The great thing is, as we're doing now, we have video calls. Yeah. So we can actually, they can still chat to their grandkids and show, you know, and we can still actually maintain that sense of community, because I think that is absolutely the most important thing. I've got friends who are sort of doing things like they're calling 2 people they haven't spoke to in 6 months a day. Yeah. And they're doing all of those sorts of things, which we can all do just to, because mental health is another thing that can really be affected if you're in isolation and you're in, you know, that's, you know, particularly if you live alone, that's going to be really, really difficult. So we can use the technology, we can have conversations, you know. I know a lot of people that have gone off Facebook and Twitter just to give themselves a break from the doom and gloom, but that doesn't stop you having, you know, Skype calls or WhatsApp or whatever your particular app of choice is with people that you know and love, and just having that chance to catch up with people. In my mid 40s, and there's a bunch of people that I don't, you know, we get together every couple of years, and now we're actually having time to chat and things like that, because it's not quite as manic as, you know, I'm not going to the football games and the basketball games and all the other sort of sporting things. And so we're seeing some really big positives. I'm actually going to rebuild my deck. That's sort of my mission when I get a bit of a break. So awesome. But I'm, you know, we've set up a wind trainer in the backyard we put one of our bikes up there, so my wife and I can sort of do that sort of stuff. I'm still doing my distance running. We've got some, you know, new weight sets to actually help, you know, keep that sort of activity. The kids run around like crazy. We've got a trampoline. We've got lots of sports equipment there doing all sorts of different things, and we're just keeping it fun. So, you know, all of those sorts of things, you know, we're cooking with the kids, we're doing all that sort of stuff. And we're not in lockdown yet, but we're sort of preparing them for it. Like, because kids in the schoolyard are hearing about it. Like my son comes today, I heard 5 kids got it and died. It's like, well, no, some kids have got it, but the 5 people that died in Australia are all over 77. So he's like, oh, okay. And, you know, just monitoring that sort of, because we think about ourselves, we think about how we're worried, but, you know, kids are probably where my focus is at the moment, because, you know, I'm kind of, you know, arrogant enough to think I can look after myself, but I do worry about the information for them, because they don't have that sort of filters that most of us have developed over a few years. And so we're having long conversations, and I thankfully have some plush viruses, some little virus toys that we can play around with and things like that. I don't expect most people to have them, but I do. So,
For sure.
we're having lots of fun with that. And we're having, showing that, if you throw a virus at this, then that will stop it. And, we're doing that with little bits of board and showing that how you can stop a virus from spreading and different bits and pieces. So, yeah, it's going to be unusual. It's going to be something that we'll all remember for the rest of our life, but we can absolutely turn it into a positive experience. And that's where my focus is. It's like, yeah, I'm worried about my company. I'm worried about my job, but I'm more worried about my family, because I think that it's such a wide ranging thing that it's, they talked about the banks being too big to fail. I think our entire economy is too big to fail. And with small business are the ones most affected. And I think they're the ones that we most have to look after as well.
Yeah, agreed. Very well said. A reason why I respect you so much, sir, not just a virologist, but also an amazing family man and fellow citizen of this glorious planet. I really appreciate you being on. You really helped add a lot of sense and science to this conversation. You make me feel a lot better, kind of hearing it, from your voice and seeing it through your eyes. And, I appreciate it. I think everybody listening right now also we're definitely better off for having heard this. And I think there's a very, a nice silver lining, at the end. A few weeks, best case, few months, most likely, by the end of summer here in the United States, we hopefully will have a very good, regular back to life talking about, wow, that was a crazy spring we had, right? That's kind of what hopefully we're looking towards right now, where things start getting back to normal once our summer really starts to kick off. If all goes well, and if everybody does what they're supposed to right now, they wash their hands, they sing happy birthday while they're doing it, they practice social distancing, they show civility while dealing with their fellow, neighbor, when they are out in the world, they smile, they get out there, they, don't panic, they look to the bright side, they become a better person, pick up a book, right? Play an instrument for the first time, maybe call grandma or, the old friend you haven't connected with in a few years, put that good energy back out into the world, right?
Absolutely. And I think, we've got it pretty easy where we are. We're in developed countries. We have internet. We have, I'm holding my phone in my bedroom, talking to someone in the US in a video call. And it's like, if I want to learn Dutch, I can do that. And I can probably do it for free.
Yeah, for sure.
We're being given a gift of time. And that's the one thing we're normally horrendously short of. And I think that one of the things we can do is just, as you said, if you've got an instrument that's been sitting in the corner, you can get the Tom Morello guitar tutorial online and, learn to play Killing in the Name of, all that sort of stuff. I try and see the positive in all of those sorts of things. And I think that, if you dwell on the negative, it's not going to make anything better. If you dwell on the positive, if you come out of your quarantine 5 pounds lighter, feeling stronger, with a new skill, having spent that time bonding with your family, and getting through the arguments you're going to have anyway, so let's just get them done. And there absolutely can be a positive to it.
Absolutely. Brother, I really appreciate you being on. I definitely want to make sure we stay in touch more often, personally and, of course, professionally. I know that our audience loves you, so we'd love to get you back on here, to talk about things. Who knows, maybe a month or two from now, as things start to change, if any big developments come up, you're going to be my first phone call. Everybody listening, they can find you at Mr. Hawkes, Hawkes, and I'll link this on Twitter. Is there any special place where people can follow you, learn more about you, if there's any way that you engage with them, or you just want people to kind of leave you alone other than when you pop your head out?
Basically, I'm pretty busy on Twitter. That's sort of where I'm trying to do a bit of stuff. But yeah, sometimes I'm, I've been, asked questions by sort of relevant authorities about how, what our capacity is and things like that. And sometimes I'm away for a couple of days, and sometimes I just want to turn off and actually just, go bush and go camping. I'm probably not going to be able to do that, but yeah, I do try and respond to anyone who contacts me. And I do, even if I disagree with you, I'm always polite. I can sort of say, we're not going to see eye to eye to this, and that's fine. And, this is what I would recommend that, you know, you have a look at and just come back to and maybe try and digest it a few different times. I'm not here to proselytize. I'm just here to say, well, this is what it is. And this is where you can get really good sources of information. And I am as flawed as anyone else. And, you know, take anything I say with a grain of salt. But what I try and do is I don't say, this is the way it is. I say, this is what the evidence shows. And I will continue to try and do that. And, you know, also direct you to really awesome people who are, you know, really specialists in these sorts of areas that I'm not.
Absolutely. Well, we appreciate you so much for being here. Thank you so much. What a great benefit we've had by having you. And we'll be in touch soon. Dr. David Hawkes, everybody. You have a great day, sir.
You too. Thank you.